Good afternoon or morning, depending on where you're joining us from. Thanks for joining the International Association of Interviewers webinar, Building the Biosafe Workforce to Prevent the Spread of COVID-19 in the Workplace, an Employee Mindset Perspective, with Drs. John Jones and Dr. Kelly Dagas from Fifth Theory, LLC. My name is Emily Kuhn, the Association Manager for IAI, and I'll be your moderator today. A few housekeeping items before we get started. All attendees will be in listen-only mode to ensure high-quality audio. We will be addressing questions at the end of the presentation, so please use the Q&A box located in your toolbar to type in your questions. And now I'd like to introduce our presenters for today. John W. Jones, Ph.D., ABB, is Executive Vice President of Research and Development at Fifth Theory, LLC. His past positions included serving as Vice President of the Human Capital Sciences Organization within the Human Capital Risk Management Group at General Dynamics Information Technology. At General Dynamics IT, Dr. Jones served as Principal Thought Leader in research, development, and delivery of personnel risk and talent management assessment solutions. Dr. Jones has more than 25 years of experience in the human capital management business. Dr. Jones helped to establish the Association of Test Publishers, ATP, in 1992, where he served as past chair of both the ATP's Industrial Division and the Standards Committee. His numerous publications include Personnel Testing, A Manager's Guide Applying Psychology in Business, A Handbook for Managers and Organizations, Virtual HR, and Advances in E-Business and Psychology. He's the founder of the Journal of Business and Psychology. Dr. Jones received his Ph.D. in Applied Psychology from DePaul University and his MBA from the Keller Graduate School of Management. He was awarded diplomat status in IO Psychology from the American Board of Professional Psychology and is a licensed psychologist in both Illinois and Virginia. Dr. Jones is a member of the American Psychological Association, the Association for Psychological Sciences, and the Society for Industrial Organizational Psychology, among others. Dr. Jones was awarded fellow status by the Association for the Psychological Science and has served as an adjunct professor of psychology for Roosevelt University's graduate program in IO Psychology, where he taught advanced courses in measurement theory and psychometrics. Dr. Jones' current research interests focus on developing and maintaining biosafe workplaces and the use of personnel assessments and organizational surveys to strengthen human capital risk management in commercial and government organizations. Helping out today is Dr. Kelly Dagas. Dr. Dagas is Director of People Analytics and Program Evaluation at Fifth Theory, LLC. She has her Ph.D. in Industrial Organizational Psychology. She has experience with research and development of selection assessments, career and education prep programs, organizational and leadership development assessments, and learning solutions. She conducts research and program evaluation of employee assessment programs to help demonstrate their impact on key business and performance metrics. I'd like to welcome you both, and I'm going to turn it over to Dr. Jones.
Okay, thank you so much, Emily. Welcome to this IAI and Fifth Theory webinar that describes how you can create a biosafe workforce by focusing on your employees' mindsets. As a licensed psychologist and risk manager, my primary focus today will be on how you can better understand and manage your employees' mindset. As a minority-owned business, Fifth Theory is fully committed to helping businesses conquer this pandemic. I'm going to be clicking off my video as I present, but a copy of the slides will be provided to all that are interested. Next. This webinar has three primary learning objectives. One, reviewing key issues allowing for the reopening of businesses. Two, understanding the concept of an employee's biosafety mindset. And three, being introduced to an assessment-based approach to building a biosafe workplace. Next. The CDC documents the health impact of COVID-19. I think most of you know, but currently there are almost 3.5 million confirmed cases of COVID-19 in the United States. and our population exceeds 328 million people. Therefore, the reality is, and conservatively, there's about 1% of the population that's been confirmed infected. Herd immunity usually begins when 40% of the population is infected and builds some immunity, but 80 to 90% must be immune to really stop the spread of a virus. What that means is that we're going to be working with COVID as a risk management, occupational safety, and asset protection topic for a number of years to come until full vaccines are available and herd immunity is established. The CDC, from my perspective, really was the first to prescribe specific employee behaviors that allowed us to reopen businesses. And you hear them every night, 20 times a day on your TV news. Social distancing, flexible work sites, downsizing and closing operations, and delivering products and services. Next. But what stood out to me early on in this pandemic is the CDC helped to conceptualize what we call in fifth theory, the Big Four approach to mitigating COVID-19 risk exposures. And the Big Four relates to being healthy and clean and wearing protective gear and masks, cleaning and disinfecting the environment constantly, social distancing, and really being open to flexible ways to interact with customers, such as pickup and delivery. Most pundits confirm that compliance with CDC Big Four seems correlated with business closings, reopenings, and reclosings, meaning the more you comply, the more likely you can remain open. Next. As many of you know, the US Department of Labor offers probably the most comprehensive website that lays the groundwork for shutting down, reopening, and probably reclosing, in some cases, especially extreme hotspots, US businesses and markets. Their key online publication is Guidance for Preparing Workplaces for Coronavirus. I'm sure all of you have probably read it, your attorneys have read it, and it's really updated constantly to reflect real-world need. As an aside, the US Department of Labor is now focusing on coronavirus pandemic campaigns related to promoting worker rights to paid sick leave, ensuring safe workplaces, and even focusing on lawful pay, especially for essential workers. So all of these campaigns are just coming to fruition and are just coming into focus. Next. This slide reflects the casino, if you want to bet what type of recovery we're going to have. Much debate surrounds the type of recovery that businesses can expect, and these assumptions drive business closing, business openings, stock market performance, both short-term and long-term, and overall business strategy. The V-shape endorsers say the virus will go away quickly. I remember when the virus first hit, people were saying it would vanish within 3 months. It really didn't. Then the U-shaped endorsers say, well, it's all going to be fine in 6 to 8 months. I think from when the pandemic was first declared a serious issue in the US, the 6 to 8 month mark will come right around August, September, October. And by the way, what the U-shape endorsers say is business back to normal. The W-shape is really the stop-start model. And This ties into a belief that resurgence can occur if you aren't complying with the CDC's Big Four. Convergence must be perfect to really keep things moving forward. And people were swearing there would never be a start-stop W-shaped model, but you're already seeing states and cities and municipalities starting to reclose certain businesses. So this could be also the landscape that organizations must behave in. And then finally, there's the L-shaped recovery, where it could take years. Many airline executives early on said 2 to 4 years before we even get back to 2019. I even heard a decade yesterday with some credible evidence. So I'm not saying which one you want to endorse, but you absolutely need to consider all recovery models at all times so that you are not stuck in a V or U shape when the world is in the W and L shape. Next. Standard biosafety and security models clearly need to be augmented. I grew up personally in the grocery industry and some healthcare industries where traditional biosafety was always front and center in our risk management effort. And you could see on the right that the safest way from a traditional point is to eliminate totally the environmental hazard. And in this case, you can't do that. So what happens is on the bottom of the inverted triangle, you see protective equipment, changing the way people work, isolating people and customers from the hazards. And that seems to be where we're at. And just to make your eyes open a little wider, even though I'm sure you're monitoring this, there's some credible evidence that the virus is mutating. This picture on the left is of the mutated virus. And the only reason that's relevant is because it means we have to be adaptive and adjusting at all times ourselves, because there could be new aspects of the virus or new symptom patterns that we need to take into consideration. So if you're a V-shaped recovery endorser, you might say, I don't need to worry about any of this. But if you're a W or an L, then you need to track with this at all times. You aren't wasting your time or your company's time. Next slide. This webinar will present different perspectives on how biosafety mindset focal points can really augment and expand traditional biosafety risk management. To simply read what's on the slide, employees must have strong biosafety mindsets to ensure that they will comply with all policies and procedures designed to mitigate COVID-19 infections in the workplace. What that means is you could have all the safety screens, all the floor markings, all the policies, all the procedures, but if the mindset isn't fixed to execute on all those interventions, then you will still have problems. So you have to get inside the mind of all employees. Next slide.
Okay, before we move to the next slide, we just have a poll question about biosafety mindset at your organization.
Let me know the results, Kelly, once you get the polling.
Okay. It's like just about everybody has responded. So I'll go ahead and we'll share the results.
Okay, so you can see about 4 out of 10 attendees are saying they are focusing on the mindset. Maybe 1 out of 4 have some informal approaches, and 1 out of 3, this will be totally new or somewhat new for them. So this helps a lot because this tells me there's absolutely an opportunity to where 100% of people are focusing on this if you're in HR, risk management, and so forth. Thank you, Kelly. Next slide. A risk management goal is to create and sustain biosafe mindsets that drive safe behaviors versus unsafe behaviors. Psychologists, measurement professionals, and data scientists at Fifth Theory are committed to advancing the science behind the biosafety mindset. At a very basic level, your employee's mindset informs the behaviors that they choose to execute in the workplace. The behaviors can be safe or unsafe, but they all have consequences. Mindset-driven results and outcomes accrue, and they can be either customer-friendly and profitable, or they can harm customers and be unprofitable. So what's a harmful type of behavior? If there's malicious spread of the virus, if there's accidental spread of the virus due to some mindset issue that was not properly managed by the company. And I'll give you 5 different perspectives on mindset today so that you could start having proper interventions. Next slide. So how do you define and measure employees' biosafety mindset? Research at Fifth Theory that I'll review today has identified 5 mindset dimensions that are on the spoke and wheel slide that you're looking at now. And I'm going to go quickly through each one of these. And these 5 mindsets are clearly relevant to the current coronavirus pandemic. And I don't expect all organizations to address all 5 dimensions, but it should be a goal, especially if we get into stop-start recovery models or long-term recovery models. As an aside, the classic long-term model was with TSA screeners, where people never dreamed they would still be at the airports permanently 20 years later. Next slide. So now we're going to quickly review each of the biosafety mindsets so that you'll be a master in this area within the next half hour. The first mindset dimension is the classic biosafety mindset. The core elements of the classic mindset are the big 4 focal points that you saw that were defined by CDC. Biosafety mindsets can be assessed when hiring new employees and when training and coaching current employees. New employees need mindsets that support all of a company's efforts to prevent the spread of COVID-19. This type of mindset needs to be continually assessed, since it can be weakened by a lax organizational culture. For example, if you have a manager, or God forbid, a management team that does not accept the validity of CDC's big 4 biosafety practices, then employees could pick this up and a company's biosafety culture could weaken over time. Managers are role models. Next slide. If an organization selects and places and trains employees to have the strongest biosafety mindsets possible, then this is what it looks like when you get inside the mind. So based on fifth theory assessments, we've done many research studies where we're able to identify what the biosafety mindset looks like. For example, high biosafety mindset employees and job candidates are very responsible in terms of biosafety. So wearing masks, protective gear in the workplace is essential. They're committed to wearing any protective gear or following any safety procedure that is prescribed to keep the store open. Distancing does not become a personal issue, it becomes a workplace policy issue so that they engage in proper social distancing at all time. In-store hygiene is something people practice religiously. I was shopping a while back in actually a high-risk state in a large retail store. And I was just so impressed that within a nanosecond of me leaving the scanning register, they were cleaning it and disinfecting it. If someone was a low biosafety mindset, they probably would not do that, even though that was the policy. And then finally, with a biosafety mindset, what you don't want to take for granted is things as simple as access, customer access, is embraced, so that things like curbside pickup, home delivery practices, escorting. I know with my dog, they escort my dog in and out of the store to get groomed. Those aren't taken for granted. Those aren't overlooked. So this is what the biosafety mindset looks like. Next. The second mindset dimension of the 5 is the customer experience, or CX mindset, as it relates to COVID-19. Organizations must use the pandemic as a reason to strengthen and accelerate their commitment to CX. No excuses at all. Next. For example, the 4 anchors of an exemplary CX strategy within a grocery store or related retail setting includes caring employees, even when they are more distressed due to the pandemic, some of the social unrest in the US and so forth. They don't back away from being caring. The store attractiveness, despite new safety barriers and markings. And I've been in stores where the markings and the barriers are extremely attractive, and I've been in ones where they look like they were patchwork. Customer security, especially in relation to acting out employees and customers. And I think all of you have probably been reading some of the case studies where customers and employees are going at it, sometimes in extremely violent ways around things like, are you wearing a face mask or not? So this is a new front that needs to be managed. And you really want CX strong employees on those front lines. And then finally, in-store safety in terms of mitigating COVID-19 risk exposures. So that's the landscape at a minimum. Next slide. So job candidates and current employees can be assessed for their attitudes related to a strong CX mindset using online or app-based assessment. Here is what a strong CX mindset looks like during a pandemic. 1, customer safety now becomes first and foremost in the customer experience. And the customer can sense that the employees want them to experience a safe environment. I told you when I walked away from the scanning how quickly it was screened or cleaned. I knew it was clean before I went there too. So my experience was positive. Customer enjoyment, despite all the hardships that the shopping experience brings to the table during a pandemic, you can still experience that as a customer, that the highest level of care and joy and experience is being offered by employees. I remember shopping at an outside place to get some hardware equipment, and an employee who I saw 3 times because my wife and I kept going back before we made our final purchase. That same employee smiled at me 3 times and put me at ease. And I went to 3 other stores and I came back and bought from him. And when we were picking up some of the granite for some tabletops, I told his boss, who was helping us to make the final selection, I said, I'm here because of that experience. And we all had masks on, we were all social distancing, but I still had a joyous, comforting experience. And then finally, the wow factor, where you're energized by the opportunity to shop. And the wow factor could sometimes be just a private label face mask that an employee's wearing with the company's logo on it, and it's an attractive face mask, and you say to yourself, wow, this company really cares about its employees. That's what the CX mindset looks like. Next. We have some psychologists, Dr. Steve Billings is one at Fifth Theory, who did some exciting pre-COVID, post-COVID research. And we had large samples where we were able to sample employees before the pandemic on their CX attitudes and then right in the middle of it. And what's interesting, even though it's almost commonsensical, is that during the pandemic, there's even more need to exhibit empathy and understanding, to provide an easy, safe, and enjoyable shopping experience, and to utilize supportive and relevant service gestures. So you can't shake hands, you can't get close. So you almost need a whole new array of service gestures, like the smiling employee to me that led to a very good sale for that company. The challenge, employees feel less in control during the pandemic. So that's why you have to constantly reinforce such a mindset. Next slide. What does the third spoke on the biosafety mindset wheel look like? This one deals with the heart and soul of the challenge with keeping businesses open during the pandemic. And it's really determining if your employees are infected or not. Next slide. So at Fifth Theory, we focus on what we call the layered screening strategy. And this is based on the premise that no single COVID-19 screening procedure is a perfect predictor. Therefore, there is a need for layered COVID-19 screening within nearly all organizations, and as a side note, even within schools. This allows companies to stay ahead of any COVID-19 surges, risk, or outcomes that could adversely impact customers and/or employees. What does layered screening look like? At the early stages, it's identifying the testing bubbles that require screening. So some workers might require a slightly different type of screening than others, but what are the bubbles that require more intense screening versus less intense screening? So obviously customer facing is more intense screening, healthcare more intense screening, grocery more intense screening. Then the second step, if you follow some of the mega trends in human resources, there's a lot of literature out there that's surfacing quickly on disruptive HR during the pandemic. What that means is you can't lead the same way and you really can't manage the same way, at least during the pandemic and maybe after the pandemic. So one thing you have to do is, guess what? Trust your employees more. So the first line of defense could be self-screens that require trust, where employees are doing their own assessment of whether they feel ready to come into the workplace or not. And then the organization does not even need to capture that information, but they do need to empower their employees, whether it's 100 employees or 50,000 employees, to be able to do daily or hourly self-screen on a low-cost basis. Then if there are any issues going on, they have to graduate to biological screens, including temperature screening systems and even basic thermometers. I recently had the nasal swab tests, and those things do take time, so they are not really applicable for the daily or hourly screening. And sometimes their cost could be prohibitive if you aren't lucky enough to get them for free. Then number 4 is assessing the biological testing, whether it's the antibody, the molecular. You almost need a degree in chemistry and medicine to understand all these tests. But they're really looking at, do you have it or not? And guess what? None of those tests are perfect predictors. Everyone acts shocked like that. But with any assessment, you could set the sensitivity level to have more what they call false positives or false negatives, meaning false positives, you're saying you do have it when a few might not have it, or false negatives, you don't have it when you might have it. And then number 5 is the real esoteric area of assessment. And this is where you get into contact tracing, which seems extremely complicated to anyone who hears about it. There's a new front that's surfacing called onboarding, substituting, then onboarding if you onboarded someone who now has COVID, and then reboarding. So you need some procedure to even have people extract themselves from the workforce. I liken this to being a basketball coach where you're substituting at all times. And parenthetically, the Equal Employment Opportunity Commission guidelines govern everything that's on this screen. And when you do get the slide deck, it was too busy of a slide for this presentation. We will give you a summary of their guidelines. Next.
We have a second poll that we would like everyone to respond to regarding layered screening. Okay, just a couple more seconds. It looks like most people have responded. I will share the results.
Yeah, excellent. All of the above, about 8 out of 10 are saying that's their focus. So the heart and the head are in the right place. But it's really you screen to keep the stores open because this is really the only way you know if you have employees interacting in a high-risk in a high-risk manner with customers. Thank you, Kelly. Next slide. During the COVID-19 pandemic, large numbers of workers were asked to work at home, put on furlough, or even laid off. I had a research team actually build what we call the Worker Readiness and Availability Index that was designed to rapidly assess if workers are ready to return to work in general and to their physical workplace in particular. Because even a concept of, well, our corporate office is empty, how do I know who I should put in as the wave of the first 25% to start working, in my mind, should require an assessment that meets all of the EEOC standards. So we started to research this area, and the mindset for is a current employee ready and available is as follows. The employee is motivated to return to work. They want to go back to work. And guess what? Not all employees did want to return to the physical work site. Also, they're more trusting of management. They trust that their management will provide a safe workplace. They know if you're providing a safe workplace or not. And this plays into their mindset about returning. They also are self-reporting that they're at lower risk from any COVID-19 symptoms or exposures, engaging in high-risk environments where they could quickly contract the illness. And finally, they're committed to self-screening, self-care, and biosafety. So what we wanted to do was really build an instrument that allowed for screening on readiness to return to work versus repurposing an online brief express screening tool that was really designed more to refer you into the hospital. So return to work is where this type of assessment fits in and where this type of mindset is very important. And also, it's going to be important when you reboard employees, onboard employees, and then reboard them again. And that will occur absolutely in a W-shaped recovery model. Next slide. This slide is just to say when we give you the handout, we'll give you access to a demo that you could actually experience in terms of, well, how do I keep my finger on the pulse of my employees to know if they're ready and available to return to work? And you can see the link there. And my feeling as a behavioral risk manager is when you look at your entire workforce, again, whether it's 100 people or 50,000, you want to use the 25% rule of thumb. And what that means is 25% are absolutely ready to go. 25% could be experiencing some concerns with virus that they don't even know, is it COVID, is it flu, what is it, but there's some concerns there. And then you're going to have 50% that are really in that moderate range, which more than likely are fine to go back to work, but you at least need to take some precautions there. But you don't want to look at your workforce and think everyone's fine. And the thing you absolutely don't want to do is look at your workforce and say, I have no idea. And we aren't talking about surveying your workforce, because surveys get at attitudes towards maybe corporate programs or things of that sort. We're actually looking at, can you survey to see if they have the mindset associated with the ability to be ready to work and available to work. So that's, you really want to know as best you can, whether it's on a daily, weekly, dashboard way, the status of your workforce. Now, this is a high-end goal, I know it, but as a thought leader, I wanted to give you that challenge. Next. This is a busy slide, but I give it as a resource slide. So if you can't see it, don't worry about it, because you're going to have it. But these are just some people I've worked with using the WRAI. One person was a nurse who's right in the heart and soul of COVID treatment daily, and uses it to really get a daily pulse check on, am I okay? Because you start imagining things and you need an objective norm reference way to see if you're fine. Then there was the physician who actually contracted COVID-19, had to go into a supervised living quarters, and wanted a confirmation other than just the biological tests, and this helped. The other was a vocational counselor at a VA hospital who was doing screening and procured it. And then after 2 weeks of self-quarantine, wanted to know, can I return to work? So obviously there was a negative biological test, but when they took the WRAI, they realized they received a yellow, lower to moderate readiness, and it was because the work environment wasn't safe. There were some ventilation problems right over the COVID ward that had to be addressed. So again, this tool is used to manage the biosafety mindset related to COVID-19. Next slide. The other is, there's all types of training going on right now around COVID-19. So the fourth biosafety mindset deals with, is the training effective? And if you look at really what has to happen for effective training, employees have to report that they're prepared, meaning they acquired knowledge, but that they're psychologically and emotionally ready to implement what they learned. We call this the can do versus the will do. I can do safe biosafety interventions with my customers at a retail store because I've been trained. There's some training on an app I went through. But will they do it? Do you know if they have the mindset that will allow them to execute? Next. So it's possible to, in a routine manner, just assess, okay, we trained 10,000 employees. We feel that 88% are prepared, but what percent are ready? And ready means they're fully confident and committed to execute what they learned, and they're resilient enough that they're going to execute it even if they feel distress. I'm amazed at how often people will offer training and they say everything's fine. We've trained all of our employees, but they really, if the truth were known, have no idea at all if those employees are ready psychologically to implement what they learned. So this is number 4. Next. And this is the most intense one that most people aren't even focusing on right now. Employees will be emotionally challenged during the pandemic. The impact of the pandemic in terms of employees' feelings of distress anxiety, and depression can lead to job-related risks that must be managed at work. We know from all the literature on behavioral risk management that increased stress triggers more workplace accidents and acts of counterproductivity. So an accident could be something like forgetting to wear a mask because you're depressed, being infected, coughing on product that's to be sold. An act of counterproductivity could be engaging in a physical altercation with a disruptive and unruly customer. So this is what we're talking about with number 5. Next. Josh Burson, an HR thought leader, noted that 50, and this is current, 2020 first quarter, 55% of HR executives surveyed made employees' health, well-being, and mental health their top issue during the pandemic. But there's other surveys out there that I've reviewed, credible surveys, where 55% of the persons who lost a job or income say coronavirus is harming their mental health. And again, when you hear mental health, you think of anxiety, fear, depression, anger, distress, the deeper levels of pain and psychic discomfort. For comparison purposes, 40% of those who have not lost their jobs also say the coronavirus is harming their mental health. So what I'm saying is 1 out of 2 or 4 out of 10 of your workers are entering this phase of mindset. And you really don't want to minimize that, even though I know that it's harder to conceptualize how you can get involved in this front. As an aside with that picture, over 500 essential healthcare workers have died due to the pandemic, and my prayers are out with them. Next slide. The uncertainty surrounding their exposure to COVID-19, a life-threatening virus, plus the constant bombardment about a high COVID-19 death count, which we know is over 100,000 right now, leads to this situation of deep distress. There's also the financial and relationship stressors that are out there. We recently did a survey with a tool we have called the Employee Assistance Profile Questionnaire, an online tool for employees to see, can I self-screen and see if I need to access my company's EAP? And at a minimum, if you use some pretty stringent cut scores, about 4 out of 10 or in the high risk range. And what does that mindset look like? They have absolute self-reported counseling needs now. They're reporting problems in living due to COVID. They're at risk for incidents, stress-related accidents due to the inability to focus on customers in the workplace. They're focusing more on their inner pain. And then biosafety uncertainty, where, incidents, they might not be able to fully self-manage and reduce risks that they bring into the workplace. So this is the 5th and final mindset. And as you can see, it's a little deeper and a little more challenging for companies to manage. Final slide before questions. So the biosafety mindset approach is designed to complement everything you're doing right now. And 4 out of 10 of the people on this call say they're already doing this or doing some degree of the mindset approach. So in closing, here's what I think you'll want to focus on at a minimum. One, make sure your employees do embrace the big 4 biosafety behaviors, especially if they're customer facing, especially if they're in an essential worker situation like healthcare, food delivery, food preparation, and so forth. Make sure you absolutely know that an employee is committed to return to work and will engage in behaviors where the odds are in favor of them being able to stay there, meaning they'll be safe. You need to know those attitudes. So it's interesting, many of y'all are certified to do intense interviewing. So you need to know what those mindsets are related to returning to work. You also want employees who will embrace and execute on COVID-19 prevention policies. I'm assuming you have the policies, but they really have to know concretely what their charge is in relation to those policies. High trust in management. You could have someone come back, and if there isn't high trust in management, if they don't believe the workplace is safe, then a counterproductive relationship could ensue. And then finally, you want emotionally hardy and resilient employees. And right now, the stats saying 4 out of 10 conservatively, 5 out of 10 from a normative perspective could be dealing with some very serious distress related to the pandemic and now some other societal issues that are surfacing. So my closing words to you is do everything in your power to strengthen your workforce's collective biosafety mindset in a manner where employees win, customer wins, and guess what? The company wins too. So thank you. And at this point, let's open it up for some Q&A.
If there's any questions, make sure that you go ahead and type those into the Q&A box in your toolbar. Anything that you want to ask Dr. Jones. While we're waiting for those to come in, I'd like to take a minute to once again thank Fifth Theory LLC, who is one of IAI's sponsors. We appreciate you guys taking the time out and your expertise for this really timely, circumstances that we're all in. I guess I have one question for you, Dr. Jones.
Yes.
How do you think now with some of the major retailers going forward with mandates of masks being put in place for places that hadn't had that previously, how do you think that's going to affect the mindset for some of these employees that now get put in a position of authority, so to speak, or having to be the enforcers of that?
Well, masks should put the employees at ease unless they have a mindset where they have values that are contrary to wearing masks. That's why you need a biosafety mindset insight. Masks put customers at ease. And also my personal feeling is I lean more towards security guards managing the harder part of policing, so to speak, whether customers wear masks or not. Because you could spread an employee's, no pun intended, attention so wide that what you do is you could save some money by having them police the mask the customers are wearing, but they might have an incident with food preparation or food stocking because they can't focus on their job. So that's my belief, but CDC masks will keep stores open longer. Next.
We have a couple questions. First, could you define the difference between a mindset and an attitude?
Yeah, a mindset as a psychologist who's been doing this for over 30 years is a collection of attitudes, values, perceptions, motivations, and beliefs. And usually a mindset is encapsulated around um, targeted area behaviors like biosafety, customer experience, things of that sort. An attitude is just one component part of that. We do a lot of attitude science work too to ensure that we know which attitudes predict behavior, but mindset is more of an umbrella concept. Next.
Okay. In your opinion, how long do you think retailers will need to hold the line for biosafety mindset? And do you think we will be in a W cycle?
I think we're in a W cycle now. If you look at the states that are opening and closing, I'm broadcasting from Chicago now, and I think our mayor will be closing some business establishments. So we're in a W mindset now. And I think until the vaccine and that full immunity, which remember is defined as 80 to 95%, is achieved, we could be looking at a 2-year minimum run ahead of us, minimum. And I think just like TSA, because 20 years ago, I worked with Fifth Theory colleagues to build TSA screening instruments. I worked with TSA when they had 4 employees. I think some of what y'all are building now for the retailers and other companies will be here for a long, long time, a decade or more. Next.
Okay. How can employers introduce these concepts and encourage responses to the related assessment tool?
Usually, you have to look at the bubbles. What are the essential workers? Who's facing customers? And you have to prioritize what I call the screening bubbles. And then of the 5 dimensions that I covered today, we had to say what's essential. So for example, we're doing some work with some security firms, with security guards, where they want some diversity attitudes assessed, they want some integrity assessed, but they also want the biosafety sensitivity assessed so that and the nonviolence potential assessed. So usually it's not just biosafety, and that's at the pre-employment phase. Some organizations, it's how do we re-staff our corporate offices. So you take it one step at a time, but you prioritize the assessments. And usually they have to be online, they have to be quick. You have to get immediate analytics around those, that feedback, and decision makings that are legally acceptable have to be made. So we have some white papers on that. So if y'all email Kelly, the answer requires more than I just said, but we have some white papers that cover that. Okay, we have time for what, a couple more?
Yeah, I can give one more. How do we move employees from being not ready to work to being ready to work?
In some cases, you have to actually screen in people who are ready to work. I mean, the markets are moving that fast. And with this test, you know, the biosafety test where you're looking at are you prepared and ready, there's actually 16 dimensions that go into that were a little more complicated than I could present today. But you would actually want to know which of those levers on, let's say, readiness, are you confident to implement, need to be addressed through coaching or through supplemental training before someone could, let's say, take a frontline setting in a healthcare. That needs to be utilize for actual training interventions that are targeted. So that answer, again, we have some white papers we'll send on that. That wasn't as thorough due to the amount of time I have left, but interventions are required in some cases. In some cases, you have to select people who already have those attitudes. So with that, we hit the time limit. I want to thank you so much. We're honored to present to members of IAI, and I look forward to my next seminar with you in the future. Thank you.
Thank you so much, everyone, for attending, and a special thanks to Drs. Jones and Dagus and Fifth Theory, one of our sponsors, for such a great discussion on a timely and relevant topic. Your continuing education certificates will be sent by the middle of next week. If you found this webinar to be beneficial, remember to visit certifiedinterviewer.com for more webinars and other great member benefits of IAI. We hope everyone has a wonderful weekend and stay safe. Thank you.